Dr. Andrews, thanks for joining us. I want to cover the topic of depression, and the first question that comes to mind is, what is depression and why can't we just get over it?
Well, depression is a lot more than the usual grief or sad mood that people get. Depression is a total body illness that affects one's thinking, one's feelings, behavior, as well as physical well-being. So people with suffering from depression will have problems concentrating. They'll typically have some impairment in memory. Sometimes they will have difficulty making decisions. They'll have feelings that are sometimes unrealistic sadness. They'll have feelings of hopelessness and helplessness. Their behavior can be affected by being more apathetic. Social withdrawal is very common. And their productivity might be decreased at home as well as work. And physical complaints might include aches and pains. They might gain weight or lose weight. They might eat a lot more or eat a lot less, or sleep a lot more or sleep a lot less.
And why can't we just get over it?
Well, it's easy when, or I guess it should say it's different when it's just a mood, and you can snap yourself out of it, throw cold water in your face. Depression is different. Depression has to do with a dysfunction of brain chemicals that affect how the brain functions. So no matter how hard you try, the brain chemicals stay like they are, and the only way to resolve that is either time or treatment of some sort.
How serious a problem is it in the United States? How big is this problem?
It's an enormous problem. It has a lifetime prevalence in the U.S. of about 16%, so everybody has about a 1 in 6 chance of having depression during their lifetime. And at any given time, there's about 17 million Americans that are suffering from depression. And it's a cost to the U.S. economy of something like $44 billion a year in treatment costs and lost productivity. So it's a serious problem.
Are some people more prone to depression than others?
Yes, having a family history is a significant predictor, it's felt. About 50% of people that suffer from depression have a positive family history. Also, women tend to get depression about twice as often as men, although men usually or more often don't get treatment because they don't get diagnosed. Elderly have a high rate of depression, and also people with chronic conditions, chronic medical illnesses, people that are undergoing significant stressors. Those are people that get it more often.
How does an individual know if he or she is clinically depressed?
Generally, the sad moods will impair their function at work or with relationships, and they will last a great length of time. The clinical diagnosis is based on certain criteria, a number of symptoms that persist for a certain length of time. A person can know that they're having a problem when the symptoms persist for, longer than is reasonable. I tell patients it's like riding in a car. You have a general idea that there's windows and there's seats, but you can't really tell what it looks like. It takes sometimes an outsider to stand outside the car and know what the car looks like.
How long does clinical depression typically last?
On average, the untreated patient will get better in somewhere around a year. So it will not go away quickly. Some in a few months, some in much longer than a year.
What are the common treatments for depression?
Well, there's psychotherapy as well as medication treatment, and both are effective. The best treatment is a combination of both psychotherapy and medications.
How effective are medications in treating depression?
They're pretty effective. There's a recent, very large study called the STAR-D trial, which looked at single treatments as well as combinations of treatments. And it shows that about 80% of people on various combinations or single treatments will get better, just the combination of medicines.
What is, I've heard this term, and I don't know if it's a clinical term or not, but what is major depression?
Major depression is just a diagnostic criteria for clinical depression, and what it means is that you have at least 5 of the 9 or so symptoms of depression that last for at least 2 weeks.
Okay. And when is it time to seek professional help, medical help for the treatment of depression?
You know, that's, again, my kind of story about being in the car. When when you're depressed, it's very hard to see things objectively. I think the main reason to seek treatment is when your lifestyle is becoming affected. You're missing days at work, your relationships with your family or friends are disrupted, something is changing your life. Those are times to really get treatment, and particularly feelings of sadness that include hopelessness and helplessness. Unfortunately, those lead to suicidal thinking.
Well, in that vein, is there hope for someone who is clinically depressed, broadly speaking?
Absolutely. The most important thing is recognition. It's thought about 2/3 of people in this country don't get treatment, and that's probably because they don't recognize the symptoms. It is a total body illness. It includes a great many things. Even experienced physicians can miss depression because of the way it presents.
Are there any new and perhaps more effective medications that are in the research pipeline on the way for depression?
There are. The standard treatment is blocking the reuptake of certain brain chemicals. What that does is allows those brain hormones or chemicals to be more abundant in the brain. And the main ones at this time are serotonin, norepinephrine, and dopamine. All the medications currently affect one or two, but not all three. A very interesting prospect in the near future is triple reuptake inhibitors, which will block all three of those neurotransmitters. And that will have the advantage of treating a broader range of symptoms in a broader number of patients, probably be better tolated, and probably work faster.
With respect to the existing regimen of medications, the existing cafeteria buffet of medications, are there serious side effects attendant to them?
There are some side effects. The best thing to advise patients is that by treating with a more common, simple treatment or simple single therapy, that reduces their risk of side effects. The main things that people experience will be sometimes headaches from the medicines, sometimes nausea, sometimes dizziness, but most of these are generally very well tolerated.
Very well. Thank you for your time today, Doctor.
Thanks for having me.